Okay, my name is Eve. My name is Eve Blessing. I work with Jivonia Creative Youth Group. It's a community-based initiative. Its its thematic areas are gender-based violence, mental health, SRHR, and gender inequality. Yeah, it was founded in 2022, and it's basically for young people to teach them or to empower them through innovation, through skills, through like just fun. So I'm here today to talk about how SRHR intersects with economic empowerment. So basically, do we all know what is SRHR? Do we? She say she knows.
Uzuri unaitwa kando yako. Social reproductive health rights.
Yeah.
Pigeni makofi.
I want it to be an interactive session. Si mi peke yangu ndo naongea. Like tusiangaliane tu. This is something that it is with us and it will be with us. Ni kitu tuko nayo ndani yetu. So she has said it is sexual reproductive health and rights. Sindio? So and what is economic empowerment? Anyone? Economic empowerment.
Interactive as possible. So East African Ocean Festival. So
Economic empowerment.
This is an ambush. You've ambushed me. But I won't say I know the meaning. But I think maybe I don't know how to put it in words. Like I feel like I have the words but they're not coming out.
We iseme vile unaelewa. Tutaunganisha mbele mbele.
Bless me.
it is not okay. What I can say, economic empowerment. When I look at economic, see money. I see ways to get the cash, the bag, and empowerment. Of course, it's the maybe the learning part. How so economic empowerment. Uh-huh. So it is how you are taught, not maybe in school, but how you're taught to earn, to get money. Yes. Basically.
Thank you. Tumpigie makofi. So she's not far from the definition. So economic empowerment refers to the ability of individuals, communities, or groups to participate fully in the economy and make informed decisions about their financial resources. Tumeelewa paka hapo? Yeah, so hauko mbali na hapo. Mbona ulikuwa unaogopa kujibu sasa? So how does si tumeshaelewa SRHR na tumeshaelewa economic empowerment. So we want to know how it intersects. Ama pia tunataka kujua meaning ya intersects. Yeah, how does it intersect? Somebody can just tell us how it intersects. Okay. Anyone? Okay. How SRHR intersects with economic empowerment.
Okay, honestly, I don't know. Maybe if you just tell me.
Like I just want it to be interactive. That's it. So actually, we have an example is family planning and education. If you can get access to, like, let's say women or young girls, you can get access to SRHR services. You can make empowered decision. For example, if you get an SRHR services on family planning, you will utazuia kupata unplanned pregnancies, so you will continue with your studies. So hiyo itazuia the unplanned pregnancies. You will have you will be empowered to make the decisions. Tumeelewa mpaka hapo, si ndio? So like, okay, get access to those services, you will continue with the education. Mpaka hapo tuko sawa. I like that. Ama nana jaileo. Yeah, so that is family planning and education. Access to family planning services enables women to plan their family, pursue education, and participate in the workforce. Kama vile our first speakers say, like, go to school, get that degree. Ni kitu unaweza brag nayo. Ni kitu unaweza bragia nao mwanaume. Si ati kivibaya. But unaweza mwambia ama degree owner da. Ama diploma holder da. Clock it, period. So the second one will be maternal health care and workforce participation. Access to maternal health care services ensures that women receive necessary care during pregnancy, childbirth, and postmortem, enabling them to return to work sooner. Example is a woman who receives quality maternal health care can recover quickly and return to her job, maintaining her economic stability. If you get maternal health care, unaweza rudi job mapema. So ni basically to the SRHR services and economy. Inakusaidia aje wewe kujijenga ki economy kwa Kiswahili? Kiuchumi, exactly. Inakusaidia wewe kujijenga kiuchumi. So ukipata kulikuwa na hii a time yenye Julie, is it Julie Gishuru or yeah, like alipata good services and she was able to go back to our screens after I think 3 weeks or 4 weeks. Yeah, so like si alijijenga kiuchumi because she did what? She got the SRHR services. And prevention and management of STIs and HIV. Access to SRHR services for STIs and HIV prevention and management enable individuals to maintain their health, reduce healthcare costs, and participate in the workforce. Basically, it's if a person living with HIV receives the antiretroviral therapy, can manage their condition, maintain their health, and continue working. Kama siku hizi, si rahisi kujua mtu akona HIV na mtu hana. Like, you can't judge from appearance, ndio? Like, watu wengi sahi wamepata hiyo education and wamekuwa empowered, wanafuata hizo medication, so si rahisi. So unapata watu wengi wanaendelea kiuchumi kirahisi because get access to those medications, right? Comprehensive sexuality education and career development. Access to comprehensive sexuality education empowers individuals to make informed decisions about their sexual and reproductive health, enabling them to pursue education, careers, and economic stability. When a young person who receives comprehensive sexuality education can make informed decision about their sexual health. Like sahi ukiambiwa, an example ni kama hiyo ya P2. Si we all know P2. Like ukijua after umefanya hicho kitendo ngono, si ndio? Mambo inaitwa twatwa. And you know, like it can, obviously we all know consequences of sex, right? So, and what can nini inaweza kuzuia from that sini P2. and it is an SRHR service. So like inaweza kuendelea na future yako. So if you are empowered kupata the SRHR services, it can make you continue with your future, right? Smoothly. Sindio? Paka hapo. You're clocking it. Then I was also told to talk economic benefits. See, SRHR in Intersect na economic empowerment. So, what are the economic benefits of SRHR? First is increased productivity. Access to SRHR services can increase productivity and enable individuals to participate in the workforce without interruption. Ni kama tu hiyo bado ya P2 na ya madawa za kumeza HIV. ARVs, exactly. ARVs zinakusaidia unaendelea na something yenye nakuletea like kiuchumi, unaendelea kiuchumi smoothly because unazi access, ndio. Then reduced healthcare cost, can reduce healthcare cost by preventing and managing health issues. This thing are just the same. Like ukipata hizo services unajijenga, ukipata pads, ukipata the ARVs, ukipata the postnatal tablets, they make you like continue with your future smoothly because unajijua, unajua kile unatumia, unajua kile inakusaidia na unajua future yako. So if you're empowered and you get access to those services, you can continue with your future smoothly. Na hizi zote unanini after umeshakuwa empowered with the SRHR services, right? Then so paka hapo kuna mtu akona swali before niendelee? Any question? So there is reduced dependence on social services. A woman who can access SRHR service can support herself and her family, reducing dependence on welfare programs and social services. Still, if you get the SRHR services, unaweza jitegemea kiuchumi, unaweza anza biashara yako because you know at this time nafaa kumeza hii dawa, at this time nafaa kunini, na wanaendelea perfectly, right? Yeah, so the challenges zenye zina come while unapata SRHR. So example ni kama uko mashinani, but sahi I think Mombasa tunafaa kuita mashinani kweli, because kuna place zenye mtu hawezi access SRHR services. I think kuna hizi youth friendly places, kama for example I come from Chuda, that is Mvita sub-county. We have a youth friendly service in Chuda Healthcare. Is it Chuda Healthcare or Chuda sub-county? Kuna Chuda sub-county hospital, sindio? Yeah, we have like very very good people over there. Ni Gen Zs kama sisi, ukienda hapo you want to be judged like totally. Unaweza ongea like openly with them, unaweza waambia niko na hii and you will not see like hizo na vile manase zingine ukuanga rude. Wewe unakujia P2, this is the 4th time unakujia P2.
Also kupata hiyo like yes though hiyo like, but now I wanted to tell this now goes to us enemy. This now goes to us as ladies. Tujitunze manzi, there's nothing good like kujitunza. These men, most of them do not care. They don't. So kitambo ama kabla ama kitambo ifike hiyo part ya sasa kitambo ifike hiyo part ya ati mimi nenda uko kuchukua hiyo P2 ama I'm gonna get an abortion because I wasn't ready. I had sex with this man. I'm protected. So now I want to like, now society is hitting me that I really need to focus on my future because now I'm pregnant. Because I had sex, sikuifanya nikiwa nimevaa nguo, nilivulia nguo yote. So it as kujitunza. Sawa, uoni au kunje boy child wanajisupport ile hai, tujitunze bana.
Okay, this goes to you. I think maybe haujiguzia sana, maybe because of time, but I feel like ungeisema. In as much as munaelimisha us girls to use these types of contraceptives, at least utuambie pia the consequences of using them. Because in as much as inatusaidia, they also have effects on us. Like the P2, it's not advisable to take them as jugu, sipoa. Yeah.
I think I also wanted to touch on the contraceptives part. Just to advise, if you are sexually active, you'd rather take injections than use P2 a lot, because you're only advised to take once in a year. Once. You can't use it as a method of contraception. So if you are like sexually active, you'd rather just use the other methods of contraception, and the most recommended is using a condom, because the other methods of contraception will help you to avoid pregnancy but not infections. But at least when you use a condom, you know you're going to protect yourself from HIV and STIs, because it is 99.9% safe. So you'd rather use a condom or abstain or udunge shindano kuliko utumie P2 kama njugu. Thank you.
Yeah, so basically kitu umesema, it's called ABCD in SRHR. So ABCD is A stands for abstinence. I think that is the best. That is the best. I repeat, that is the best. Yeah, abstinence, that is like refraining from sexual activity if you're not in a relationship, situationship, or marriage. And B stands for B stands for being faithful. So that includes if you're in a relationship or marriage, just be faithful. Having one partner is also self-hygiene, very high level of self-hygiene. Ukikuwa tu like huyo mmoja, si wewe ndio ulichagua, mbona uende uonje flavor nyingine? Si uliamua ni chocolate, mbona unataka vanilla kesho? Itabidi umeng'ang'ana tu na hiyo chocolate. Hakuna mtu alikuchagulia hiyo chocolate. Yeah, so being faithful. C stands for consistent, a correct and consistent use of condom. I repeat, correct and consistent use of condom. Ukiamua unatumia condom. So there is this one, there was one time I was facilitating. Then mtu akasema ati condom moja like unatumia the whole session. But that's not the correct use. I don't know if, see, we are all grown-ups here. Condom moja, round moja. I hope unanielewa. Short moja, condom moja. So kama unajua wewe ni King Kong, nunua tu hizo 45. Yeah, kama unajua wewe ni kimoda, nunua tu hizo condom zako 45. Akimaliza shot ya kwanza namwambia baba, toa. Mimi unipatie STI hapa. Toa. Alafu I hope we all know jinsi ya kuvaa condom. Si ndio? lazima kukuwe na hiyo tip ya kumwaga the semen, because obviously tunajua kuna time ngoma inapigwa vizuri, so like that nini inaweza burst, so utadhani ya mtu amevaa kumbe kitu lilipuka kitambo. So that tip is very important. Tumeongelea shot moja, kondom moja, leaving the tip. Alafu kuna nyingine tulinini ati people use like nitaje na ijwala ya viazi. Mimi nitaka guy nylon ya viazi. Like yeah, we were shocked. Ati unanunua viazi uweki kwa juu weki anything, but hiyo mafuta iko, then you just ingiza. So that's why I was keen on telling people places where SRHR services zinapatikana, because wanapeana condom free. Nasema lubricant haitoshi. But pia unaona time yenye unatumia condom, kuna varieties. For me, where? Like there is this thing, hata kama unasemanga ni expensive, but it's good. Durex. Mtu yote anajua Durex. Durex condom, it's good. Lubrication, 100%. Longevity, 100%. Yeah, so it's good. Hata kama mna, like hapa tunaangalia future yetu. Sasa utaangalia kitu ya so na maisha, huyu mtoto atakuja hapa atakaa na wewe the whole of the years zenye utakuwa unaishi. So that is good kama for wewe umesema lubrication. Yeah, and D stands for diagnosis and treatment. So kama unajua, hata one of the preventions of STIs ni ku regularly treat. Hata kama una feel uko sawa, kuna zingine huwa zionyeshi, unapata uko stage 4 ya gonorrhea, umevimba kuvimba, so like regularly just go. Zingine ni bure, ama unaweza pata mtu atakwambia maybe 150 or 200. These youth friendly services are very good. So like nenda tu utestiwe hata kama una feel uko sawa. Sometimes unaweza feel kama kuna hii discharge from the vagina ikianza kunuka mwanzo, like so we all know it's not supposed to smell. If you feel like that, if you smell that fishy smell, you can just go and test. Hizi vitu kwa na stages, so unaweza feel hiyo time maybe inanuka tu nimetoka kunyesha, and you just assume it. Unapata inafika umeenda sasa hiyo time yenye kukojoa ni uchungu, ku bend ni uchungu, like kuchuchumaa ni uchungu, ndo unapata sasa like inakuwa na do nyingi, then ina take a lot of time. Unapata umepata fungal infections zimejaa huko chini, and obviously hata kama uta heal haitarudi like normal. Yeah, so that is the ABCD in SRHR. Anything somebody wants to add before I take my seat?
Go to that center. Do you have the opportunity to sit down with a qualified practitioner who will advise you on the various types of methods that are available, so that you don't go and say, this is what I had my friend is using, and also use the same method on me. Do they give you an ability to learn and then to have a choice, and also get out, get knowledge on the risks of the various hormonal methods, or even, for example, the coils that are available? Can we go and sit down and have a conversation?
Yeah, unaona mwanzo ukiingia tu kuna like a reception, then like they ask you which service do you want, then ukisha sema service unataka, wanakupeleka kwa somebody akona ujuzi ya hiyo part. Then like kama mfano umesema you want to go for the family planning, they will sit you down wakwambie everything about the family planning, different things, nini zao, side effects zao. Like they will tell you everything. Hapo nayo ni 100%. They will tell you everything. Kuna hii na hii na hii. Side effects zao ni hizi na hizi na hizi. And they will ask if you are a young mom, ama ujawai jaribu. Yeah, they will ask such question. Kama ushawai jaribu, ama ujawai, and they will tell you, kama ujawai, this is best for you. But wewe unafeel unataka gani? Then ukichagua something, then watakwambia, like mimi according to ujuzi yangu, I feel this is best for you. So like mtakuwa na hiyo nego, like such conversation unapata. And alafu pia you about kama umetumia P2 sana, they will watakwambia utumie hii na hii. So ni wewe ndo utadecide at the end of the day, but watakuwa wamekupatia those nini according to their according to ujuzi yao. So iko such services iko.
You are encouraging us rather than kwenda chemist kuchukua off the counter self treatment and diagnosis. We look for the nearest facility and make time for that.
Yeah, that is what I'm encouraging here.
Yes.
Like uko unapata kujua a lot, na hata kama ukifeel wewe maybe uliendea coil na wamekukatazia hiyo, they'll tell you like uende like ufikirie hizo side effects zenye wamekuambia, then you come back. Like it's better kwenda kwa hizo youth friendly services than just going kwenda kuchukua kwa chemist, because there you will utatoka huko kama umelearn a lot na umejua hiki kitu yenye nimeeka iko na side effects gani, ama nitarudi lini tena kwenda kuchukua, ama hata ukitaka kutoa watakwambia. Anyone else before mkae chini? Thank you.
So tumpigieni makofi.